First off, take a deep breath. You made it through surgery, and you are officially in the recovery phase now. If you're watching this, you've recently undergone a full-thickness skin graft, and our goal with this guided explainer is to walk you through exactly what to expect. We want you to heal comfortably and confidently right at home. We just want to take a quick moment to say thank you. Thank you for trusting Advanced Dermatologic Surgery and Dr. Thomas Hocker with your care. You know, Dr. Hocker is a Harvard and Mayo Clinic trained, triple board certified dermatologist and Mohs surgeon, and he's been recognized as a Castle Connolly top Mohs surgeon. The whole team here is so incredibly grateful to care for you, and we are completely committed to making sure your recovery is as smooth as your procedure. In this explainer, we're going to walk through exactly what you need to know. We'll cover the first 48 hours, what to do about bleeding, how to handle your bandages, the all-important thick Vaseline phase, your activity restrictions, and finally, your long-term cosmetic recovery. Let's dive right in. Okay, let's talk about those critical first 48 hours and what you should really be expecting. So here's a quick look at your healing timeline. For these first 2 days, your only real job is to rest. You've got to keep that graft dressing completely dry and keep all pressure off the area. Now, as you move into days 3 through 7, don't panic if the graft starts looking dark or purple or kind of bruised and uneven. That is completely normal. Once the office actually removes your dressing, that's when we enter what we call the thick Vaseline phase. And then, looking ahead to weeks 2 through 4, you'll see the color and texture of the skin continuing to change as it heals up. Now, I want to talk about what might feel a little scary at first, but is actually totally normal. Bruising, color changes, and swelling, especially if your surgery was near your eyes, are entirely expected. In fact, if your surgery was on your head, your eyes might literally swell shut temporarily. That's okay. Also, bleeding on the day of surgery, and even the day after, is totally expected. Your bandage might get completely saturated and even leak some blood. Again, completely normal. But we do need to talk about true warning signs like a fever or a rapidly expanding purple lump. Which brings us to managing bleeding and knowing exactly what those warning signs are. Here's the absolute most important thing to remember. Bleeding is almost always controlled with pressure. If you start bleeding, you need to press firmly and directly right on the surgical site using some gauze, a clean paper towel, or a washcloth. And you need to hold it there for 30 full minutes. And here's the golden rule. Seriously, do not lift up to check it or peek before those 30 minutes are up. Peeking breaks the seal that's trying to form. You might actually need to do this a few times. But if the bleeding just won't stop after a few back-to-back 30-minute attempts, that's when you need to call the office. We also really need you to be on the lookout for 2 specific complications: hematomas and infections. A hematoma is basically a pocket of blood collecting under the skin. Warning signs for this include a rapidly expanding, firm or painful lump, a dark purple mass, pain that's getting severely worse, or any new issues with your vision, breathing, or swallowing. If you see any of these, call the office immediately. As for infections, the warning signs are a fever over 104 degrees, chills, spreading redness, warmth, swelling, thick yellow or green drainage, or pain that starts getting worse after day 3. Keep in mind, infections usually show up around days 3 to 7. All right, let's move on to your bandages and a vital concept we call the 2-site separation rule. This rule is so important. You have 2 distinct areas right now: the donor site, where the extra skin was taken from, and the graft site, where the new skin was placed. Please listen closely here. The bandage on your donor site is just a bulky white pressure bandage meant to control bleeding. It's actually not medically necessary for healing. If it gets completely soaked with blood, you should take it off before applying that 30-minute pressure we just talked about. And if it just falls off on its own, don't worry. Just start cleaning that area daily with mild soap and water and put a thin layer of Vaseline on it. But the graft site is a completely different story. It's covered with a flesh-colored tape bandage or a bolster. Do not touch this. I really can't stress that enough. This bandage has to stay completely dry until your follow-up appointment. Keep it out of the shower spray and absolutely do not remove it unless Dr. Hocker explicitly tells you to. Now, what happens after that graft bandage finally comes off? That brings us to the absolutely essential thick Vaseline phase. To understand why this next step is so crucial, let's look at a little bit of the science. A skin graft needs a quiet, protected environment while new blood vessels grow into it. Right now, your graft doesn't have a mature blood supply, but it's still losing water, just like normal skin does. We call this process transepidermal water loss, or TUWL. And because the graft can't replenish that moisture with its own blood flow just yet, TUWL is a massive risk right now.
So, because of that constant water loss, your main job, once the office actually directs you to start graft care, is to apply a very thick layer of Vaseline over the graft at all times. Think of this thick layer like a physical moisture lock. It seals the water in, minimizes that TEWL process we just talked about, and frankly, it keeps the graft alive. If you don't keep it thickly coated, the graft can dry out, which is called desiccation, and it can literally fail and die. So please, keep it heavily coated.
Next up, let's talk about activity restrictions and how to physically protect your healing skin. For at least the next 2 weeks, you need to completely avoid heavy lifting, intense cardio, bending over, or any strenuous activity. Skin grafts need 2 to 3 weeks of strict protection while their new blood supply matures. Now, if your surgery was on a high-tension area, like your torso, your arms, or your legs, you might actually need to avoid heavy lifting for 3 to 4 weeks. The basic rule of thumb is this: avoid anything that raises your blood pressure, stretches the area, makes you sweat a lot, or puts direct tension on the wound. But don't worry, light walking around the house is usually perfectly fine, unless Dr. Hocker told you otherwise. As we look a little further down the road, let's touch on your long-term cosmetic recovery and scarring. Once both the graft and the donor site are fully healed and the skin is closed up, sun protection is going to become your absolute best friend. The sun can actually permanently darken a healing scar or graft, and we definitely want to avoid that. Generally, you can start using sunscreen, makeup, or scar reduction products like Silogen, if you pick that up at the practice, about 4 weeks after your surgery. But of course, follow whatever specific instructions you get at your follow-up appointment. We know we've thrown a lot of crucial information at you today, but if you take away just one thing, let it be this reminder from the entire Advanced Dermatologic Surgery team. When you are unsure, call us. Seriously, if a graft turns completely black or white, if the edges open up, if you're having trouble breathing, or if you just feel really sick, seek help. Never ever hesitate to reach out to us if you feel uncertain about how you're healing. We are here for you. And that wraps up our guided explainer. Honestly, the only thing left for you to do right now is rest. Have you had a chance to review the personalized instructions Dr. Hocker gave you? And is your recovery space set up with a few extra pillows so you can keep your head elevated? Take a little time right now to finalize those at-home preps, make sure you're keeping that graft site totally dry, and then just let your body do the incredible work of healing. Thank you so much for joining us, and from all of us here, we wish you a very smooth and restful recovery.